Are you one of those guys who's up 3 or 4 times a night just to pee? You've probably been told that's just part of getting older. But it's not. I'm Dr. Rena Malik, urologist and pelvic surgeon, and today I'm gonna walk you through the real reasons you're waking up at night, what you can do about it starting tonight, and when it's time to talk to a urologist or your primary care doctor. Most men, and honestly a lot of doctors, assume that nighttime urination is just a prostate problem. And yes, the prostate absolutely matters. The prostate is a walnut-shaped organ that sits right underneath your bladder, and the urethra, or the P-tube, runs through the center of it. It starts growing in most men around their 40s, and when it grows, it can squeeze that channel and make it harder to fully empty your bladder. That's called BPH, or benign prostatic hyperplasia. And up to 40% of guys over 50 have symptoms related to it. But that's not the only cause. I'm going to review the 4 causes that make you wake up to pee at night. Number 1 is making too much urine at night. Your body has a built-in system for this. A hormone called antidiuretic hormone surges at night and tells your kidneys to hold on to water. But that system runs on your circadian clock. And when you disrupt that clock because you're not sleeping well, you have stress, you've got shift work, ADHD doesn't surge the way it should, and your kidneys keep going like they do in the middle of the afternoon. And there's another layer here too. When you have poor sleep, it drives up your body's sympathetic nervous system, aka your body's fight or flight response. Now, when you have overactivity of this system, it's significantly associated with worse urinary symptom scores in men with BPH, and even predicts prostate size because it creates more muscle tone, which tightens the smooth muscle around your prostate and the opening to the bladder, making it harder to empty your bladder fully. Next, if your legs swell during the day because you're sitting or standing for many hours of the day, or if you have a heart or vein issue, that blood is pooling in your lower body. The second you lie down, fluid starts returning back to your bloodstream and your kidneys filter it out, making you have more urine that ultimately wakes you up at night. Also, if you have other medical conditions like diabetes, heart disease, or you're taking certain medications like diuretics, especially in the evening, will make you make more urine. The second cause is your prostate. When you have that enlarged prostate, it makes it difficult to empty your bladder, which means your bladder fills up faster. It can also make your bladder respond to that blockage, so it becomes overactive. So you feel urged to go even when you don't have to. Your brain and bladder stop working together. Number 3 is just overactive bladder. Some guys just have overactivity and it has nothing to do with the prostate. Often in guys who have like spinal cord injuries or other neurologic problems, it's a real thing. And so what happens is you have bladder contractions when you really shouldn't. So it gives you that urge to pee, that I gotta go, and even wakes you up at night. The 4th reason is the one that people miss the most. Sleep apnea. 40% of men who wake up at night to pee or have nocturia have obstructive sleep apnea. Now, sleep apnea is a very common sleep disorder where the throat muscles relax and physically block your airway, which causes you to repeatedly stop and start breathing throughout the night. Now, every time you stop breathing, the drop in oxygen strains your heart, and your heart responds by releasing a hormone called atrial natriuretic peptide, or ANP. This tells your kidneys to dump sodium and water, basically making you make more urine. Again, not because of your bladder, not because of your prostate, but because of your airways. And this matters because when you treat sleep apnea with like a CPAP machine, it actually reduces nighttime bathroom trips by up to 2 times a night. Meaning if you're waking up 4 times, you'll wake up 2 times. And that's one of the largest treatment effects we see for anything we do for nighttime waking. And there's a vicious cycle here. When you have sleep apnea, you have disrupted sleep. This disrupted sleep impairs the hormonal system that keeps that urine production low at night, which causes you to wake up more, which further disrupts your sleep. So if you snore, or your partner notices you've stopped breathing at night, or you wake up exhausted all the time, talk to your doctor about a sleep study. It might be the single most effective thing you do. So what can you do starting tonight to improve your wake-ups? There are very simple science-backed techniques that you can use that will help you wake up less often and improve your sleep. Number 1 is think about when you're drinking. Stop drinking fluids about 2 to 3 hours before bed. What happens very often with my patients is they don't drink all day because they're working. They go home and they're really thirsty and they drink a lot right before bed. And then of course they're going to be up at night because they drink a lot. They also may keep a glass of water at their bedstand. They may be drinking further medications before bed. And I realize you can't fix that, but try to move things up a little bit or just sip on water if you're really thirsty in the evening. Number 2 is watch what what you're eating and drinking before bed. So certain things can irritate your bladder. That can make you have that urge to pee more often. The most common ones that irritate people are caffeine and alcohol. So ideally avoid those in the evening. For some people, citrusy fruits and juices. For some people, it can be artificial sweeteners. It can be tomato-based products, or even for some people, just sparkling waters altogether. Now, I don't want you to just get rid of everything, but you can experiment. Try one thing for a few nights, see if it makes a difference. And if it doesn't, keep it in your routine. Number 3 is manage that leg swelling. So if you have leg swelling, elevate your legs above your heart level for 30 minutes in the late afternoon. Consider wearing compression stockings during the day. And if you're on a water pill to help with that swelling, talk to your doctor about taking it in the afternoon so that the fluid flushes out sort of during the day rather than during your sleep. Number 4 is double void. Now, what is double voiding? You urinate, you wait 30 seconds, and you try again. I tell people who are sitting, sit, stand up, walk around, sit back down. If you're standing, stand, maybe consider sitting the next time, or just walk around and go again. This will help you empty more completely. And it really works. I see it all the time in my patients. Next is what we call timed voiding and bladder training. There is a component of sort of fixing your brain and bladder here. When you have the urge to pee, it goes up like this, and you feel that urge really, really strong, and typically people run to the bathroom at that point. If you distract yourself and wait, that urge will go away and you can walk calmly to the bathroom, and that'll help. Also, if you go on a schedule, oftentimes I'll find people who literally don't pee all day, and then they get home in the evening and they're peeing like every 30 minutes. Try to not be in a situation where you're holding your pee for too long. You should go every 2 to 3 hours during the day, and then at night, ideally just once or not at all. If you're someone who already goes very frequent, like say you go every hour, what I tell people is go every hour on the hour. If you get the urge before an hour, do that sort of distraction technique and walk calmly to the bathroom. Once you've got that down for about 3 days, then you increase the time to 1 hour and 15, then 1 hour and 30, and so on and so forth. Next up is address your metabolic health. Now, this is the hardest one, but if you have insulin resistance, obesity, poorly controlled diabetes, all of these things worsen urinary symptoms through multiple mechanisms. They increase inflammation, they make you make more fluid. There's some direct effects on the bladder and prostate when you have sugar around. If you're overweight, work on weight loss. Include exercise, reduce processed foods and sugar. All of these things are going to help manage your blood sugar and your overall health. It's hard, but it is worth it. And of course, get screened for sleep apnea. Guys, if you snore, if your partner's noticing that you wake up and like choking for air, you wake up with headaches or feel exhausted no matter how much you sleep, ask your doctor for a sleep study. You can now get home sleep tests. They're widely available. They're super convenient. And as I mentioned, treating sleep apnea can be the most effective intervention to help you wake up less at night. If these lifestyle changes aren't really doing it, if you're up 3 or 4 times a night, you're exhausted, your quality of life is bad, medication can be very, very helpful. And so you can talk to your doctor about medications like alpha blockers, like tamsulosin, silodosin, alfuzosin. They relax the muscle around the prostate and bladder neck so the urine flows more easily. And the good news about these is that they work pretty quickly within days. There are some side effects. Some people get what we call orthostatic hypotension, where they get dizzy when they stand up too quickly, or retrograde ejaculation or less ejaculate volume. So if that bothers you, please talk to your doctor. And if you're gonna plan cataract surgery, make sure you talk to your ophthalmologist, because these medications can cause something called floppy iris syndrome, which can make that surgery very difficult. There's also 5-alpha reductase inhibitors like finasteride or dutasteride that actually shrink the prostate over time, about 18 to 25%, and they take about 6 to 12 months to work. But really the goal is to prevent the prostate from getting bigger. Now there's a landmark trial called the MTOPS trial. It's one of the most important BPH studies that was ever conducted. It took 3,000 men and randomized them to get prostate medication or not, and followed them on average for 4.5 years. And they found that finasteride reduced the risk of BPH progression by 34%. Now, there are significant side effects like decreased libido, issues with erections, and ejaculatory volume decrease. I made videos on the side effects of these medications, so you can check those out. Now, if you're really struggling, both drug classes together, called combination therapy, is even more effective. In the MTOPS trial, when you combined these medications, they reduced the risk of progression by 66%. Now, one of my favorite medications to use is tadalafil, or Cialis. It's the same medication we use for erections. It's also FDA approved for BPH. It relaxes the smooth muscle in the prostate, bladder, and urethra, and it does improve BPH symptoms more than just taking a placebo, especially if you're dealing with both urinary symptoms and erectile dysfunction, and most people can take it. It's only contraindicated if you're taking nitrate medications for heart disease, like something you put underneath the tongue for chest pain. Common Common side effects are headache, flushing, or muscle aches, but most people tolerate it very, very well. You can also try overactive bladder medications that work on the bladder. Specifically, if you're mostly bothered by the urge and the going often, this may be better than just taking a medication for your prostate, but again, a discussion you should have with your doctors. There's two classes of medications, which I've talked about here on this channel before. We have anticholinergics, which sort of prevent the overactive bladder from contracting, and they improve how often you go to the bathroom and prevent leakage. They do have some really bothersome side effects, dry mouth, constipation, and there's some data on linking them with cognitive issues. The other class is beta-3 agonists, mirabegron and ribegron. These have a much more tolerable side effect profile, and they work through a different mechanism, basically on different receptors, to relax the bladder muscle. They're much better for older patients, specifically even recommended by the American Geriatric Society because of the less side effects. And we have so many options for enlarged prostate now. There are over 10 options, both surgical, minimally invasive options, and you can check out my podcast episode on the top 10 options. You can watch it here on YouTube or listen to it on your drive to work, and you can learn about each and every one of these options in detail. Bottom line is, waking up at night to pee is something you don't have to accept, and there are options to help you, whether it's lifestyle changes or things we can help you with at the doctor's office. If this helped you, share it with someone who it might help, and subscribe to the channel. And as always, remember to take care of yourself because you're worth it.